Most people walk into a hospital with complete trust. Like, no doubt at all. You see the white coat, the equipment, the whole setup, and you just assume, yeah, I'm safe here. But what if I told you, sometimes that trust is exactly what gets people into trouble? Not always. Not everywhere. But enough times that it's honestly a little uncomfortable to think about. Because there have been real cases in the US where people went in for treatment and ended up getting procedures they didn't actually need. And I'm not talking about small mistakes. I mean serious stuff. Surgeries, aggressive treatments, things that can change your life permanently. The weird part is, the US healthcare system is actually one of the most advanced in the world. Like, the technology? Insane. Doctors? Highly trained. Hospitals? Some of the best you'll find anywhere. So you'd think everything should be perfect, right? But here's where it gets complicated. Healthcare in America isn't just about saving lives. It's also a business. And once money becomes part of the equation, things can get messy. Hospitals make money from treatments, tests, procedures, and yeah, surgeries bring in a lot. Now, obviously, most doctors are doing their job the right way. No question. But the system itself? It sometimes rewards doing more, not necessarily doing what's needed. And that's where the problem starts. There's one case that still blows my mind every time I think about it. A cancer doctor named Farid Fata. Patients trusted him completely. I mean, you're dealing with cancer, right? You're scared, vulnerable, you just want answers. And he gave them answers. The problem is, some of those answers weren't real. He diagnosed people with cancer who didn't actually have cancer. Think about that for a second. And then he treated them. Chemotherapy. Strong, painful treatments. The kind that completely drains your body. These people believed they were fighting for their lives. But in reality, they were being used. For money. Some of them suffered permanent damage. Some didn't make it. Eventually, he was caught and sentenced to 45 years in prison. But honestly, by then, the damage was already done. And if that sounds like a one-time thing, it's not. There was another case with a heart doctor, Mark Midei. Patients were told their arteries were dangerously blocked. And if you hear that, what are you going to do? You're not going to argue. You're not going to Google it mid-appointment. You trust the doctor. So people agreed to surgeries. But later on, it came out that many of those blockages weren't even serious. Some didn't exist the way they were described. So people went through heart procedures. Real surgeries, real risks. For something they didn't actually need. That's not just a mistake. That's life-changing. And this is where it gets a bit uncomfortable to talk about. Because it's not always just one bad doctor. Sometimes it's the system. There have been reports, lawsuits, even whistleblowers saying that in some places, there's pressure to do more procedures. Not directly like, but more like, let's increase numbers. Let's improve revenue. Let's not miss opportunities. And when you translate that into real life, it can mean more surgeries, more treatments, more bills. Now imagine being on the patient side of that. You go in trusting everything. You come out with scars, debt, maybe complications you didn't expect. And the worst part? You might never even know it wasn't necessary. That's the scary part. Not just the actions, but the fact that most people don't even question it. Because honestly, why would you? You're not a doctor. So yeah, why does this still happen? It's not a simple answer. Part of it is money. Part of it is oversight, not always catching things early. And a big part of it is just trust. We trust doctors because we kind of have to. But maybe blind trust isn't always the best idea. And just to be clear, this doesn't mean hospitals are bad or doctors are out to harm people. Most of them genuinely care. Like, truly. But these cases, they show that the system isn't perfect. And when something goes wrong in healthcare, it's not like a small mistake. It's personal. It's serious. And sometimes, it's permanent. So if there's one thing to take away from all this, it's simple. Ask questions. Get a second opinion if something feels off. Understand what's happening to your own body. Because in a system this complex, being informed might be the most important thing you can do. And yeah, if this made you think a little differently, then it was worth talking about.